Good day, sir. So this video shows the administration of topical medications. So topical administration of medications involves applying drugs locally to the skin, mucous membrane, or tissues. Topical drugs such as lotions, patches, paste, and ointments primarily produce local effects, but they can create systematic effects if absorbed through the skin. So the purpose is to nourish the skin and protect it from harm. So it is indicated that the topical treatment is for dermal infections, and for the contraindications, hypersensitivity to the specific substance, concurrent the use of muscle relaxants and other relaxants, and other neurotoxic drugs. So for the special considerations, if the skin is inflamed, instruct the patients to use only warm water rinse without soap for cleaning. Then teach the patient how to manage transdermal patch that begins to peel off before the next dose is due. Then instruct the patient to wrap applicators, use patches, and similar materials and dispose of them into cardboard or plastic disposal containers. Then the equipment needed are the following: the gloves, the 2x2 gauze pads for cleaning, medication container or application tube, the gauze to cover area, then solution to wash water if indicated, then medication, and lastly the tongue blades or the cotton applicator.
The first step is to perform drug study with the following information: to anticipate patient's response and to avoid clinical errors, and to know the purpose of the medication. Next is to check the MER to ensure right medication, right dosage, right time, right frequency, and right route of administration is provided to the right patient. The last step for preparation phase is to check each medication card against the physician's order according to the institution's policy. This comparison helps to identify errors that may have occurred when orders were transcribed. After this, we can secure all the necessary equipment and obtain appropriate medication, and then bring this medication to the client's. Next would be the performing of hand washing and donning of the gloves to observe appropriate infection control procedures. Next is inspecting the skin for lesions, rashes, erythema, and breakdown, and noting the presence of excessive body hair. We can now proceed to applying the medication and dressing as ordered. For cream, place a small amount of cream on the tongue blade and spread it evenly on the skin, and then expose the area to be treated. Next, pour some lotion on the gauze and pat it evenly on the skin following the direction of hair growth. If a liniment is used, rub it into the skin using long, smooth strokes. Repeat the application until the area is covered, and apply a sterile dressing as necessary to avoid contamination. Assess the client's response right after the administration of the drug. Return to the client within the appropriate time frame and report significant deviations from normal to the physician. Remove gloves and perform hand hygiene and dispose all supplies appropriately. Provide a clean gown or pajamas after the application if the medication came in contact with the clothing. And then the last step is to chart the medication administered.